In this video, we'll learn about Angelman Syndrome. It is an important neurogenetic disorder. It has a genetic cause. Normally, a gene which is present in chromosome number 15, that is UBE3A, that is ubiquitin protein ligase E3A gene. It has two alleles, okay? One comes from the mother, one comes from the father. The paternal imprinting happens in this case in normal people. Paternal imprinting meaning the paternal allele is silenced. The gene which has come from the father is silenced because of DNA methylation and all. So, but the mother's gene is the one which we have received from the mother is active. So, what happens is now normally only maternal UBE3A is active in neurons. But in this Angelman syndrome, the one which has come from the mother is also become defective. So, paternal is anyway normally silenced in everybody. So, the only one which was active was maternal gene that has become defective in this condition. So, the clinical presentation of these Angelman syndrome babies, if you see, there is mainly they present with severe developmental delay, and they'll have very limited speech. Like they don't talk anything. They often with no words, and they have a very happy demeanor. Meaning they have a very happy, excitable personality, always like smiling, and they'll be laughing. And if you see the motor involvement, they'll have ataxia or jerky movements. They can also have microcephaly. Usually the baby by around the age of 2 to 3 years, they'll develop seizures, and they'll also have a lot of sleep issues. So how can we diagnose this Angelman syndrome is mainly DNA methylation testing, because this is the imprint what happens on the paternal chromosome. So by testing this DNA methylation, we can diagnose this Angelman syndrome. And also if uh, the also you can do what is called as UBE3A gene sequencing can be done. There's no treatment for this Angelman syndrome. Only supportive care makes a difference. Or symptomatic treatment is what is given. For example, like if a baby has a epilepsy, give anti-seizure medications. For speech improvement and all, speech and physical therapy can be given. But remember, early intervention helps improve some of these outcomes. So, and remember, like these cases are sporadic, okay? But some genetic subtypes, especially this UB3A mutations, what is happening? No, it is inherited sometimes. So, it's like genetic counseling may be essential for families if they're going for another baby. So here, I think in Angelman syndrome, what you can understand is there's only one active gene which has come from mother, because the father's one has become inactive naturally. So if the mother's or gene what has been inherited also becomes defective, then we get what is called Angelman syndrome. Thank you.